What up, tribe? Take two. Totally messed up the first live, so we'll try it again. Welcome back to all of the replayers, and thanks for joining me to all the live audience. Totally messed up the scheduled live broadcast, had to redo it. Realized I was talking for upwards of 3 minutes to no one. So, take two. YouTube Live today, spontaneous recording. I had some thoughts that I wanted to get off of my brain into the internets and out onto the tribe. A lot of information going around the internet about the rona, the short term used for the coronavirus or COVID-19. There's this new buzzword going around called Infodemic, which is a parlay off of the term pandemic. So it's some sort of really cool term that we've come up with that talks about the unsurmountable amount of information that is circulating the internet in regards to the coronavirus. Who do you trust? Who do you not trust? Who's reliable? Who's not reliable? I thought maybe I'd share some of my thoughts and some of the things that I look for when it comes to consuming information. I'll leave a couple links down in the description once this live recording is over. So if you're catching this on the record, you hopefully will be able to see all of the links that I include in the description. Talk for a few minutes about my thoughts, and then if anybody has any questions from the live audience that they want to talk about, we'll do a little bit of AMA. Hashtag Hey Sean. So, Vic, thanks for hanging out with me in the live feed. Anyone else that's out there, give me a hello, a thumbs up, say, what's up? So, Infodemic. This is well, I can't say the first, but this particular pandemic is stressing all parts of the public because we don't know what to believe. There's a lot of varying sources of information. There's a lot of confusing and conflicting sources of information, not only at the local level, but at the national level. So the public, as well as healthcare professionals in general, are a little stressed and maybe just a little angry. I want to use a much more colorful term, but we're here live on YouTube, and you know the Google gods will strike me down if I start talking in my own tongue. So we're going to try and keep it well behaved. The pandemic, we became a pandemic, and we had a state of emergency. At the time of this recording was about 2 weeks ago, and ever since then there has been a fire hose source of information on all things Rona. And the problem is we have no idea what's real, what's not real, what's shock journalism, what is substantial. This is still what we're calling a novel virus. Novel is another cool term for the word new. It is a new virus. So we're still learning about it day by day. What we knew or thought we knew about the virus just less than 2 weeks ago is mostly obsolete because we're gaining new information. There's a lag time in anyone that knows evidence-based research, evidence-based practice, evidence-based medicine, nursing. There's a lag time between discovery and recommendation. So we're still in the discovery phase. So all of your frustrations and your confusion is valid because even those who are much smarter than me and who have a lot more degrees and a lot more initials and a lot more experience than me, they are equally confused. They are equally frustrated. So we got to go with what we know at this given moment in time. Here's the most important aspect of consuming information on the internet about the pandemic. And before I forget, I want to say hello to some of the live audience, some of the tribe members out there. We have Amanda, Victoria, Dive Into the Word. That's the name they're going with. I can't pronounce that name. Crystal, Christine. I'm not even going to try and pronounce the username of this particular tribe member. Y'all got some very interesting usernames, I got to tell you. Mine's real hard. It's my name. So here's my best piece of advice when it comes to consuming information about anything related to the pandemic, is that I want you to check your sources 3 times. 3 times to validate the information. Is it something that's repeatable from different sources? That's the first thing. Let me finish. So you read something about the notion on using non-steroidal anti-inflammatory, so NSAIDs. There was some information a couple weeks ago talked about not using ibuprofen. I want you, if you're interested enough in that piece of information, and as a healthcare provider, whether you're pre-nursing, nursing, or beyond, you need to verify the information. So you need to find it in 3 different resources. Here's the key. You can only use one resource that is a news article, a blog article, a opinion piece. That's one piece of information because it's unreliable. It's an opinion. It's literally someone decided to talk about something. That's like you and I blogging about crocheting, or deciding to go on Instagram and talk about the latest natural weight loss pill. Okay? It's just opinion. So opinion means nothing. I don't care how many degrees you have beyond your name or how much experience you have. It's just an opinion. So out of the 3 resources, your first resource can be any type of news information that you get your hands on. You get 1. So that's your first piece of evidence. Now you need to find 2 pieces of evidence that have a higher level of reliability, repeatability, and validity. And as someone has pointed out already, who has spoiled has taken away my thunder, Christine is talking about grade the evidence. So in the world of evidence-based practice, evidence-based medicine, there is a pyramid of grading evidence. And we're not going to go, that's beyond the scope of this video. It's okay, Christine. It's beyond the scope of this video. But I want you to be able to find whatever information you're interested in. I want you to find that information on a reputable national organization. Now, for me in critical care, that could be the Society of Critical Care Medicine. That could be, American Association of Critical Care Nurses. It could be one of your local organizations. It has to be a national organization. And I said organization, so it could be a website. It could be any kind of advocating organization. Yes. So I can't pronounce this user's name, Pangasius, forget it, gonna chop it to pieces. They're talking about websites like the CDC or the WHO. The WHO. So World Health Organization or the Center for Disease Control. 2 good, reputable, reliable. Oh, well, thank you, Julia. I'm not going to remember that by the end of this video, but I will try and remember it. So Julia is correct. The second piece of information, or the second resource, should be a reputable, reliable national organization. CDC, the WHO, or one of your local organizations is suffices. So that's your second piece of information. First resource is a blog, a website, an opinion piece. Second resource is going to be a national website organization. The third resource is you got to find some sort of journal related article. This is the kicker. This is the key. This is what usually disqualifies all of the information. And in this current state, this virus is so new that there's not a lot of peer-reviewed information out there because we just haven't had time. So you're going to have to go with non-peer-reviewed, at least peer-published information. So researchers, physicians, healthcare professionals in some way who have gone through and tried to study whatever it is you're interested in learning about. There's no way that you're going to get a blinded study. There's no way that you're going to get a high level of research information on anything going on with the coronavirus. So your third resource is going to have to be at least something that has been published by professionals, by healthcare professionals. If you can find three resources, three sources of information talking about the same thing in the same way, you could be fairly confident that that information is at least accurate at this given moment, or at that given moment that it was published. And that's about as much information as I can give you. It's our job as healthcare professionals, as educated human beings, to take everything with a grain of salt. Everything should be taken with a little bit of hesitancy. Don't believe everything you read, because otherwise everybody be jumping off the bridge. Hopefully you've heard that before. So I would highly recommend starting. You can view any kind of resource you want just for your own, personal information, personal increase in information. Second resource has to be a reputable organization. And currently, most of the information about the coronavirus has been made free. It's free of charge. You can go to the Journal of American Medicine. You can go to the SCCM. You can go to New England Journal of Medicine. All of those websites are producing this information free of charge because it is that important to share this kind of information. As a sidebar, if you look up the hashtag FOAMED, F-O-A-M-E-D, free open access medical education, some of that information is valuable. At least it will help you take pause in the information that you're gathering. And all that stuff is information that was created, vetted, discovered, or produced by healthcare professionals who are interested in elevating the educational level of other professions. The FOAMED hashtag is throughout the internet, so you can look at it anywhere. It's on Instagram, it started on Twitter, it's on the internet everywhere. So I would highly recommend that. I'm going to start to wrap things up, so if you guys have any specific questions in relation to the Rona, yes, I'm going to start calling it the Rona. If you have any questions, any burning questions you have in regards to Rona, please feel free to ask them in the live feed. If you post them in the comments, I will do my best to try and respond to them. While we're waiting, if anyone is typing up their questions, I think I finally decided that my live broadcasts are going to live here on YouTube because it's easier, it's simpler, I can schedule them. I know there was a lot of the tribe members that wanted to do it on Facebook because of the convenience factor, and some had asked to put it on Instagram, but there wasn't a lot of draw on that. So we're probably going to stick with YouTube because that's where most of you hang out. Dive into the word. Is asking the question, is this thing as dangerous as they say? It's not about its danger. It's about the surge. That that thing you've been reading about with social distancing is helping flatten the curve is a real thing. So we're not worried so much about how deadly it is. We're worried about it overwhelming the system. Does it kill people? Yes. But so does the flu, so does pneumonia. I've seen it. And it's not only how fast it's spreading, but what is called the prodromal period is that this thing takes up to 14 days to cook. So you could acquire touching something in the public, or get a package delivered, or it could be in your car. It could be anywhere in the world, anywhere you function on a fomite. You acquire it, and it'll hang out on you, around you for 14 days. You could be asymptomatic for greater than 14 days, in some cases up to 23 days from what I've read, before it would actually cause anyone any problems. So you're going around and you're spreading this thing everywhere for 2 weeks and never even know it. So imagine everyone showing up. It's kind of like when the state of emergency happened and everybody rushed to the stores to buy up all the toilet paper, which buys up the toilet paper and grocery store, sanitizer. We've used up all the ventilators and we've used up all of the ICUs. Worried about the surge. It's going to stress the system to the point where we don't have the equipment, which is already a problem, or it will infect and it will put healthcare professionals out of commission, either because they're too sick to work or they're still an active transmitter, so they have to be in quarantine for 14 days. So they're not in the hospital for 14 days. So you're out of work for 14 days. Imagine if 30% of your workforce is not at work. That's why this is a problem. Someone's asking, how is my facility letting us know? How is your facility letting healthcare workers know? I am going to go and defer that one because I'm not sharing, because of HIPAA violations and my facility asking us or directing us. I am not sharing anything that my facility is doing because I am in the public eye. If this was a conversation between you and I personally, then I might be able to share that information, but not sharing that in social media, sorry. How is the field? I know that there are some service you're getting used yet, being charged for it. Now it's free. There's other services out there that are free. I know that the word I want to use, but making the stresses of dealing with Rona. So there are things out there. I don't have any specific links to share you. I just know that it's find out any information. I'll be glad to put it in the links or in the comments below. Is asking, how do you know anything about the program for nurses where they have to be apart from their families for about 3 months to be able to help people with Rona? I have no idea what you're talking about. Who in the world came up with that? 3 months? I'm sorry. I have no clue what you're talking about. That sounds like a bunch of brouhaha. Someone's asking, are you teaming up with I'm not sure how to answer that. I can only tell you that my ICU is equipped with intensivists, and we do all of our own intubations, anesthesia. Nothing's changing in my practice. I'm going to leave it at that. I don't know if the approach to patients with respiratory distress who are persons under investigation or who have the positive coronavirus, the approach to their respiratory distress is very different. BiPAP, CPAP, oxymizers, we're not using any of those things because they can aerosolize the virus. If it's in your respiratory tract, you have it or potentially have it. Anything that aerosolizes the virus will magnify the number of that are out there in the world. So no more do-a-nib treatments, no more, unless and every scenario is different. This is not a carte blanche, blank NT suctioning, not doing any bronchoscopies. You're not doing invasive treatments down into the respiratory tract unless it have to be in a negative pressure room. So the approach to management of a patient who is a PUI or positive COVID is a very different, a much more streamlined approach because we don't want to aerosolize the virus. Someone's waving. I'm waving back. Victoria says, any advice in regard to new grads becoming nurses in this time? I don't have any new advice that I wouldn't give a new grad outside of this pandemic, is that you don't know nothing, and you have 2 ears and 1 mouth, so you better listen twice as much as you talk. And quite honestly, do your best to protect yourself, your loved ones, your family and friends. This is a really tough time for new learners, and I'm gonna be honest with you. There are a lot of places that are turning away new learners right now. A lot of students and new grads are being put on pause because we don't want to expose them. And it's not because we don't trust you, it's because we don't know enough. And maybe it is a little bit that we don't trust you because you don't have enough experience. It's not that you're doing anything wrong, it's that you don't know what you don't know. And while you're motivated and eager to learn and to pitch in and help, you're of no use if you're sick. I hope that answers your question. Victoria says, my new grad program is placing all new grads into a flow due to the pandemic. I'm not sure if that's a smart idea. Float pool, I mean, so the reality is, it's not a question of if, but when. This is going to hit everyone everywhere. That's a guarantee. The problem is, we just want it to and make sure we have the ability and capability to fight this appropriately and save as many lives as possible. And that's truly what this is about. We're just trying to buy ourselves time. I read an article that I thought was really insightful, and it talked about actually the world, I guess we could say, in America, Americans have been put into 2 classes, A and B. Care related information, whether you're part of the testing, developing the test, the care, epidemiology, supporting the healthcare staff by working in the hospital, you're B, so that category A can do their job. And it's really that simple. That's why we're doing the social distancing. We need category B to just buy us some time. John's asking, has my DNP program changed much due to the pandemic? My entire courses in nursing were converted online. Well, John, my DNP is completely online, so the answer is no. I am doing a bridge program. I already have my master's. I'm going to get my doctorate. I'm going back to school to get my doctorate. So I'm doing a slow go pace, 2 years, 1 class at a time, all online. It was the most convenient thing for me. I already have 8 years of clinical experience, so this is literally just getting the degree, just so I can have the doctorate. Regardless of how and who is catching and engaging, I don't know about you, but if I found a recorded live broadcast and it was an hour long, I don't know if I would actually watch it. So I'm hoping 30 minutes, ideally 20, but if we can keep them at 30 minutes, maybe people will watch them on replay. Thanks for hanging out with me in the live feed. Thanks to all the replayers. You know how to find me. You know what to do. Make sure you subscribe. And as always, make sure you check your own pulse first.